The urinary tract is normally sterile. So when bacteria enters that normally sterile urinary tract, a UTI can occur. UTIs can be classified as complicated or uncomplicated, and that classification depends on how bad it was and what is affected. Typical UTI manifestations include dysuria, which is painful urination, frequency, urgency, and cloudy urine. As those UTIs become a little bit more involved, we usually see back or flank pain, fever, and it can even turn into sepsis. And if your patient becomes septic from a UTI, we classify that as urosepsis. In older adults, the early symptoms that we typically see are generalized abdominal pain and altered mental status. Having an indwelling catheter puts a patient at a higher risk for developing a UTI. A UTI associated with a catheter is referred to as a catheter-associated urinary tract infection, also known as a CAUTI, abbreviated CAUTI. A CAUTI is classified as a healthcare-associated infection, also known as an HAI. If a patient has a catheter, we want to take special things into consideration to prevent the patient from developing a UTI. Those things are strict insertion criteria, early removal, and frequent perineal care. To diagnose a UTI, we'll typically look at their white blood cell count, a urinalysis, and a culture and sensitivity. We do this by sending urine off to the lab for testing, and we do this using the clean catch technique, which is when we will have our patients use an antimicrobial cleanser before they void, and we'll try to get them to collect the urine specimen midstream. We use antibiotics to treat UTIs because antibiotics kill the bacteria that's causing the infection. We also have these patients increase their fluid intake to help them void and flush out the bacteria that's in the urinary tract. We also use urinary analgesics, and that is to help prevent the dysuria that these patients typically experience. These urinary analgesics have a common word part of AZO. Something special to teach your patient about this drug, phenazopyridine, is that it turns the urine orange and stains clothing and surfaces. Also teach these patients to seek early treatment because they can become septic. The type of medication used to treat the UTI will depend on whether this is a fungal infection, a bacteria infection, or if this is a complicated or uncomplicated UTI. When using antibiotics, it's important to consider the use of probiotics. Antibiotics kill both good and bad bacteria. Probiotics put the good bacteria back into the patient's gut, and that helps to prevent your patient from developing C. diff. When we're using antacids with antibiotics, we should consider the timing of those antacids because those antacids can change the pH of your patient's body, and that can change the effectiveness of the antibiotics. So for our timing considerations, we want to give probiotics 2 hours after the antibiotic because remember the antibiotic kills both good and bad bacteria. So we give the antibiotic first, allow that to start working, and then we give the probiotic to put the good bacteria back into the gut. And then we want to give antacids 2 hours either before or after we give the antibiotic. Populations at risk for UTIs include older adults, and that is due to things like BPH, incontinence, urinary retention, or poor perineal hygiene. Debilitated patients. A lot of times they may use chronic catheters or because of limitations may have poor perineal hygiene. Immunocompromised patients are at risk for all types of infections. And lastly, chronic kidney disease patients. With chronic kidney disease, many times we see patients who are anuric or have oliguria, so they have a decreased urinary output, so they aren't voiding as much to help flush out the bacteria that's in the urinary tract. What these preventative measures have in common is staying hydrated and voiding frequently, having good perineal hygiene, and avoiding catheters or having good catheter care if a catheter is needed. When educating a patient diagnosed with an uncomplicated UTI, what dietary modifications should you include in teaching? You want to increase fluids and avoid bladder irritants. While reviewing discharge instructions, the patient states that they will stop taking the prescribed antibiotics when symptoms subside. How should the nurse respond? The nurse should educate the patient to take the full course of antibiotics because of antibiotic resistance. Looking at these labs, you can tell that the patient is getting better because their white blood cell count is going down.